Hey,
Hello,
everyone.
everybody.
Hello. Welcome.
Nice to see you.
Good to see you guys too.
It's
Nice to
nice
see you too.
in Ontario. We finally have a sunny day. Like we've had so much rain here. It's nice that it's finally a sunny day in June, our last show before we all take a break for the summer, which is lovely. So we are excited that you're all are joining us.
Yeah.
Tanya,
And Kat's back, our world traveler.
Oh, yeah. It was awesome. 3 weeks of like 4 countries.
Oh,
London, Wales, I was going to say Budapest, but that's not a country. So Budapest and Vienna, Hungary and
Austria.
Austria.
Yeah. Did you do a cruise?
No, we just planned our own trip, and my daughter's living in Wales right now, so we went and met her in London, went and did the Mamma Mia virtual, like not virtual, the experiential dinner party that you see all over Instagram. We did that in London. Saw a lot of beautiful sights, and then went to Budapest and had a really nice trip. Went to Vienna, went to the Euro conference, the Euro Perio conference, which was really cool.
Yeah.
And then to Wales, and then back to the Cotswolds in England. So it was a trip of a lifetime.
Sounds like it.
And I'm just back this week. Yes, and I'm just catching up. Yeah.
Are you waking up
good.
at 4 a.m?
Yes.
Yes.
It's horrible. Like every morning, 3:30, and then by 2, I need to go home and take a nap.
I bet.
Yeah. It should pass
Well, we're
soon.
very happy that you made it home safe, and we've all been just like
Thank you.
living through you, watching your pictures. So
My
thanks for sharing all
reels.
those with us. Yeah.
Thank you.
Yeah.
Thank you.
Well, we're excited about today.
Yes, we are excited. So should we get started? Yeah, it's 12 o'clock. So welcome everyone. We're excited to be here with you today. Just before we get started, I thought I would introduce myself, and we can introduce our fellow cast members here. I'm Kathleen Bocrossi, the founder and president of RDHU. So for those of you who are new, we've been in business for 16 years, which is unbelievable when I think about that. We provide professional development for dental hygienists in person here at RDHU and also online. We do live streaming and on demand. And that's a little bit about RDHU.
Nice.
I'm Carrie.
I'm Becca Parks. Okay.
We're going to fight, okay? Fight to the duo. I'm Carrie Lipacek. I am excited to be here. I work at Clinical Research Dental as their clinical specialist in education and dental hygiene. And I have been fortunate to with Kathleen at RDHU for 6 or 7 years, or maybe it's 8 years. I always mess up.
It's 10 now, Carrie.
Shh, don't tell. I shared a picture from us from my very first seminar, and I was like, wow, we've aged nothing. And it's 10 years. So yes.
You look like a baby. Yeah.
Yes.
Well, I'm Becca Parks. Thank you. So I have been a dental hygienist for 20 years. My classmates and I are celebrating our anniversary. I've been a speaker with RDHU for 8 years myself now. And I'm the clinical affairs manager for Periodontal. A little bit about me.
Hi, I'm Anna Louise Tolan, and I've been part of RDHU since the very beginning.
Yes.
And I've been practicing for 40 years and this year, and I still love it. So and I'm very delighted to be here today and put a spotlight on Tanya and the education she's going to give us today. It's going to be great.
It's going to be a great one. And just before we dive in and I introduce Tanya, just a quick note, if you want to say your hellos and where you're from, which I see a bunch of you already doing, you can do that in the chat. But if you have any questions, please put them in the Q&A, and it just helps us be able to monitor them, and we'll try to answer as much as possible, because we think there's going to be a lot of questions about today. There's a lot of excitement and buzz going on around Perio Protect. Yeah, so that's it. If you are looking for your CE certificate, give us until midweek next week, and we'll upload, whether you're with us live or anyone who registers is going to get the recording as well. So by midweek next week, you'll have a short Q&A or short post test in your portal, and then the certificate will populate after that, okay? So just give us a few days to get that going, and by Wednesday of next week, you should have that in your portal. All right, so now let's get on to today's guest, the lovely Tanya Dunlap. She's a Vice President of Clinical and Business Development at Perio, where she has worked since 2005. Previously, she served as the Perio Research Liaison, working with researchers and microbiologists testing Perio in controlled clinical trials. Her expertise on this adjunctive periodontal therapy is grounded on the research data, explaining how the prescription trays work and which patient candidates can benefit from. So I did a little bit of research on you, Tanya, and you have quite the impressive bio. So that's a very humble one. So I hope you share more of your story with us because you are a fabulous person, and we're so happy to have you with us here today.
Well, thank you. I'm so honored to be here. You guys have done all this excellent work for these years, and I get to join you. And so it's my pleasure to be here today. We also, Beth, you said you were celebrating 20 years with classmates. We're also celebrating 20 years with Perio this year. So it's just a wonderful time now that Perio is easier in Canada to have this conversation. So thank you for your interest, everyone, and thank you for having me.
So that's great. And, when you're celebrating your 20 years, just thinking, can you tell us about the beginning? You were there from the start. So
I was.
Maybe you could share a little bit of the early years and the mission and the goals of the company.
Yeah. So if you all, I don't know how long all your viewers have been in dentistry or in hygiene here. Can you think back to those early years when biofilm was just becoming a thing? Right, we talked about plaque, and then our whole paradigm shifted so that you have this community of bacteria, and then most biofilm-based diseases that are periodontitis is a classic biofilm-based disease, and so Perio was coming we really found it in 2005, just before biofilm became known well. It was kind of an accidental discovery in some ways. So Dwayne Keller was the dentist. He trained as a periodontist. In the end, he decided he was going to focus on temporal mandibular joint dysfunction. So that's really what he did. But he had a general dentistry practice. And I know this general dentistry practice inside and out because I worked in it when I was a teenager because he was my father. So he had several patients, like all of you do, who were struggling between office visits with gingivitis or periodontitis. And they just, those chronic infections, they just don't go away. And you want better for your patients. And he wanted better for his patients. And he tried, he's one of those guys, if you think about a mad scientist, he doesn't have hair sticking up all over, but he is one of those relentless scientists, doctor scientist, who just won't let the status quo go. He wants to figure out some other way to make this happen. So his first invention, which did not work well, but it had some promise. It was floss, and every few centimeters there'd be some tufted areas, and he soaked it in an antibiotic because back in the day, we all believed that antibiotics were the answer for bacterial-based infections. We've learned so much more since we've learned about biofilm, but this antibiotic, it was a tetracycline, and it was called sumaisin at the time. It was bright yellow. They soaked the floss in there. You took it out and you would floss with it, and it would flick yellow stuff all over the place. Some of his patients got better. It went to controlled clinical trials and it totally fell flat. And he won't give up on things. And he went back and he started thinking, what else am I going to be able to do? And what really motivated him was his own mother. She ended up with periodontal disease. She was probably in her 60s at the time. And they did a quad surgery, as you do. And she came back in and he said, you're looking good, Mom. We're ready for the second one. And she said, oh no, we are not ready. I'm not going to do it. This is back before lasers were an option, right? She said, I've lost some gum tissue. I have food traps. There's lots of sensitivity now. I would rather lose my teeth than do this again, which he wasn't going to allow to happen. And so she said, I'll try anything you want that you think is going to work. I'm not doing this again. So the floss worked somewhat for her, but not really because it doesn't get deep enough, right? You can't get that medication in the floss deep enough. So he came up with a tray idea based on those early studies of gingivitis, not gingivitis, but whitening, where patients who used whitening trays, if they had gingivitis, they had some improvement. So he thought, okay, well, that's not going to work because the whitening tray stops the medication from getting access to the tissue. So he started playing around with tray designs. And then he finally came up with one that uniformly worked for patients. It has an internal peripheral seal. And the seal with the extension beyond it worked like a gasket and pressed the medication really deep. So that worked for my grandmother. It worked for many of his other patients. And then he took it through FDA. And then the accidental part is here. He was recommending hydrogen peroxide in the tray with the antibiotic because he thought that he needed a propulsion agent. The hydrogen peroxide, as it's bubbling up, it's releasing oxygen, but it's also increasing the volume pressure of gas inside the sealed tray. This makes sense. Hydrogen peroxide bubbles up, it's releasing oxygen. It turns into oxygen and water. You're increasing the volume pressure in the tray, especially on your maxillary arch when you try to get that medication uphill. That's what he really wanted. He had a patient who came in and he said, "You look terrific. Keep this up." It's one time a day at this point. And she said, "Do I need that liquid medication?" Which was the antibiotic. And he said, "What do you mean? Do you need the liquid medication? You haven't been using it?" And she said, "No, I ran out of that months ago." And then he said, "Oh, huh. Well, we'll get you some more." But then he started to think like it wasn't the antibiotic that was working. And that's when he started to really learn. This is in 2005. He went back and he was trying to learn more about hydrogen peroxide and its use in dentistry. And it has a really long use. But he ended up calling on Bill Costerton, who's a fellow Canadian. Did any of you know Bill? He was such a wonderful man. He was a microbiologist who was one of the two people in the world who coined the term living film, a biofilm. And he was a microbiologist, and he was trying to help everyone understand the importance of understanding its structure and how the cells communicate. And Bill, as most Canadians I know, I love Canadians. Like most Canadians, he's such a nice man. And he said, "Well, I have time next week. Can you come up?" And so Dad flew up. And they started this conversation. And then Bill started doing proof of concept work with the microbiological background and the studies. And that is really where we came. I got to know Bill very well. I worked with him closely. I learned so much from him. Those early days were really fun. It's still fun now, but it was really fun at the time to have these discoveries and just to see how many patients were benefiting.
So are you saying then, because now knowing Periogel, the hydrogen peroxide piece is a pretty big piece of the puzzle. Are you saying that that discovery was accidental?
That discovery was accidental. That's right.
Wow. That's wild.
It is wild because then you realize, so then we started testing different concentrations of peroxide, right? Like how high can we go? How low should we go? And we ended up at 1.7% because it has a great kill rate of bacteria at 10 minutes. It releases oxygen for 17 minutes in this formulation, but it didn't cause many sensitivities. So you could go up as high as 3.4% and still be over the counter considered in the US. So we tested 3s, we tested a little higher than 3, but people complained of a lot of sensitivities. So then we backed it down, and 1.7% was really, this is how things go. You have a small beta group of people who you're working with. And the hygienist one day called Dwayne Keller and said, at 1.7%, they started at 1 and they went up from there. And 1.7, she said, the plaque literally looks like it's melting off the teeth. I think we can stop. Because plaque is basically biofilm, right? It's Streptococcus mutan based biofilm. And hydrogen peroxide is a broad spectrum antimicrobial, and it works against all kinds of bacteria. It breaks down protein chains. That's how it lyses a bacterial cell wall. The cell wall's got a bunch of protein that links it together, and you cut through that and you kill the cell. So it was really effective. at working. It's an anti-plaque agent also.
That's so exciting, because if there's anything we need in our arsenal, it's honestly opportunities to reduce that biofilm and to break down that plaque. So you had me at plaque for sure, without a question. Honestly, you had me at plaque reduction. But if we were to try to figure out our patient base, like who would potentially be that ideal candidate? So we've got to make sure we have our assessment data, and this just also reminds us of the importance of gathering the assessment data. But who would be that typical patient base?
So Perioprotect works in a variety of ways for patients, and we recommend it for anyone with 10 or more bleeding points. So that would be from gingivitis. Like, why would you wait to lose bone before you recommend something that you know is going to be effective, especially for your patients with comorbidities, with type 2 diabetes, cardiovascular disease, family histories of these diseases, pancreatic cancer, all these colon cancers. Putting that health history into your equation is so important for patient education and for them to make really good decisions about their own treatment choices. So anyone with 10 or more bleeding points, so you would start at gingivitis, but all the way to the gamut with gingival care through periimplantitis. Now, I want to be specific and say this is home care, right? This is prescription home care. It doesn't work without your in-office procedures. It supplements that, but it just makes patients, it empowers them, let's say it this way. It empowers them to keep their mouths cleaner between office visits, to keep the inflammation under control between the office visits.
Okay, so Tanya, share with us, how would you talk to a client about that?
Yeah. So I'm going to share a screen with you here. I have a 40-second video. It's available for anybody who wants it on YouTube. Let's get the screen up. And I'd like to start with the video, and then we can pick some of this apart. So most people come to us, to Periprotect, because they want to improve the health of their patients. And you can see that tray right there. If you've never seen a Perio tray, it's got a blue marking on it that just is our logo, but it's super flexible, really comfortable when you need it to be comfortable, when you have swollen, inflamed gingiva. The easiest way to talk to a patient about Periprotect is just to use this video. And this is the way I would do it. Gum disease starts when bacteria congregate along your gum line. And our concern is that they don't just stay there. They create this colony deep between your tooth and your gums in an area that we call a pocket. And it is difficult to clean this pocket at home with a toothbrush, rinse, or floss, because it just doesn't get deep enough. And that's why this infection is chronic. And this is why we prescribe Perioprotect. It's a custom-made tray that gently will deliver the medication deep in the pocket so the medication can fight the infection. You just wear it 10 to 15 minutes at a time. Not only are you going to have healthier gums, you get whiter teeth and super fresh breath. And then we say, stop talking, because you told them a lot, right? You told them they have an infection. It's deep below the gums where toothbrush, rinse, and floss can't get. And that you have a gentle solution that will not only get them healthier, but whiten their teeth and freshen their breath. And I'm going to take this opportunity just to show this. This was one of those studies that Bill Costerton oversaw. This is a microbiologist and an endodontist teamed up and at University of Southern California when Bill was down there for a while. This group glued they're like portions of a microscope slide. Tiny carriers is what they call them. And they were sterile, and they put them in 5 and 6 millimeter pockets. And this is a 6 millimeter pocket. And they left it in there for just 48 hours, and it's completely colonized. And I totally geek out on this image. I love the 3-dimensionality of it. You can see all the different shapes of the bacteria here. This is what you're fighting, and it grew in 48 hours, right? So Periprotect is not a standalone therapy, but it is an excellent way for your patients to gently deliver medication so the medication fights the infection. And not only does it fight the infection, but what's additionally important, like you said, we had you at plaque. I would say we should also have you at oxygen, right? Because when the peroxide's bubbling up, this is the key to why it works so well. It's not just killing bacteria, and it's gentle. It doesn't kill all the bacteria. It only kills the surface layer of cells. But as it's bubbling up, that oxygen is trapped inside the sealed tray. So there is an internal seal with the extension, which works like a gasket. the oxygen gets driven deep into the periodontal pockets, and it changes the microenvironment of the pocket. So you're looking at this ecological change. And when you add the oxygen, your body is eventually going to absorb it. But while it's there, it is toxic to your gram-negative obligate anaerobes. And it creates a healthy environment for healthy bacteria to repopulate. So this is why PerioProtect is so helpful. It's the combination of the two things.
That's awesome. I was just going to ask you, so why does it work so well? But
Well,
there you
yeah,
just
so
answered.
so it works well in this case because you get the hydrogen peroxide, because it's just 10 to 15 minutes at a time. You need to wear it 10 minutes for a good kill rate. You want 15 for most of the oxygen benefits, but this gel is really different than liquid hydrogen peroxide. If you've ever seen a graph for how when brown bottle peroxide, I'm assuming it's brown bottle in Canada, yes? Yeah, okay. You're at a pharmacy. Brown bottle liquid, you've got a cut on your hand, you pour it on your hand, right? It foams, right? Okay, Perio gel does not foam. If you have a cut on your hand, it works really well in this way too, but you put some gel on. The first time I did it, I was looking at the tube to see if it had expired because I knew it was going to be slow, but I didn't know it was going to be that slow. You see, it takes a minute or two before you see bright, tiny white bubbles. They're really bright white. And then about 3 or 4 minutes in, the entire cut is covered in these tiny bright white bubbles. And it stays bright and white for a long time, like a lot longer than you would expect if what you're expecting is liquid. Liquid hydrogen peroxide has an explosive rate of activation. By 2 minutes, it's oxygen and water. Periogel is very different. The formulation of the gel has a slow, consistent release of oxygen. So what that means for you clinically is if you wear your trays for 10 minutes, and we know you need 10 minutes to get a good kill rate of the bacteria, that's great. But if you go for 15 minutes, you get almost all the oxygen benefits. And I routinely wear mine past, past 15 minutes, just because it's convenient. It doesn't help me. It also doesn't hurt me.
How long have you been wearing yours?
I've been wearing mine since 2005. Yeah.
Oh,
No
wow.
eating or drinking restrictions. Yeah. And I can't say I've done it every day for 20 years. But I'm really regular. If you skip a day, especially if you drink red wine when you skip that day, you will notice the next morning that you're like, oh yeah, not nearly as clean. There is a Perio
Oh.
Protect Clean that even you all, and I know you guys take great care of your oral health, right? Even you all would notice this Perio Protect Clean. It's your breath is super fresh. So for those patients who you can smell before you can see, right? Those patients, even them, you're going to knock out the odor in the first week with PerioProtect if the odor is caused by the bacteria that's also inducing the disease. It could be keto breath, it could be some other reason, but if it's the bacteria inducing gum disease causing the odor, you're going to knock it out in the first week. Yeah. And then a lot of people stay with it just because you get such white teeth without eating or drinking restrictions. They're part of
I like that.
Yeah.
Tapping into that, motivation of the patient too, right? These are kind of side effects of the treatment, but that's going to keep them motivated to keep using it. So it won't be one of those things they use for a couple of weeks and then kind of fall off the bandwagon. They're going to want to experience those pleasant side effects, right?
Right. And I don't know, you guys tell me, you treated thousands of patients between all of you. How many times do you talk to patients about disease and they want to talk to you about whitening?
Yeah. All the time.
Yeah.
But we have white teeth. Can we do whitening first? It's like,
Yeah, this is, you get them both, which is great.
Can you explain, I know with that image, sorry, when you showed that image of what the tray looks like, there's clearly a distinction between the PeriProtect tray, because it goes on top of the gingival margin, versus a whitening tray. Could you just explain the benefits as to why that was invented or why that's the best carrier?
Sure. So this is the only tray on the market that has FDA clearance for deep delivery. So we had to show the results that you could get it deep. It's also the only tray on the market that has the research showing the results. So in combination with scaling versus scaling alone, patients had significant reductions in bleeding, inflammation, pocket probing depth scores. They had whiter teeth. We also saw less plaque in one of the controlled clinical trials. But the reason that design is so important, and I can pull this up, I forgot to talk about the gum score. This is such a new, innovative way that we are talking about Perio Protect to patients, but let me pull this up first, and then I'll go back to that image of the tray. So if you had a whitening tray, it would stop the medication from getting access to the tissue because those whitening gels are just so strong.
Right.
Your lowest whitening agent is 10% carbamide peroxide. That is the same as 3.4% hydrogen peroxide. So in the US, that's your legal limit you can use over the counter for treatment, not for cosmetics. So here, how high do you guys go up? Do you go up to 30% carbamide peroxide?
Yep.
For whitening? Yeah, that seems crazy to me. It, I, okay, crazy is not a word I should use. I think that is going to cause tremendous sensitivities at 30%. And so 10% is your lowest agent, and it works well. It's fast, right? If you're going to do something every day, and we do recommend that usually you start twice a day until your first tube of gel is gone. It's about 3 weeks, and then you drop down to 1 time a day. The reason you start twice a day is that every application, you're peeling away the exposed surface layer of cells. You will significantly decrease the load, but you never get rid of all of them, and we don't want to. What we want is a healthy microbiome, and that oxygenation helps change the environment. So you get a change in the kind of bacteria that repopulate. So you get a healthy bacterial community. At 1.7%, which would be half of that strength, you do not have nearly as many sensitivities. If you were going to use a higher strength concentration, I would not use a Perio tray because it is going to hold the gel, getting back to your design question, it's going to hold the gel against the exposed surface, but also deep into the pocket, and it just burns the tissue.
I love that you're addressing this question as well, because I find frequently the question that I'm being asked is, can I just use my night guard, or can I just use my Essex tray or my whitening tray? Right. So what you're doing is explaining why that gasket is so important. That extra kind of 4 millimeters is so important.
Yeah, it is important. We do ask for 4 millimeters of tissue to be captured on your scan or your impression. That's what Beth's referring to, so that we have enough room on the internal edge to create the proper seal. We do recommend, sometimes like sleep appliances or removable dentures. It's not a bad idea to put Perio gel on that. And then put your denture back in, for example, or depending on what your sleep appliance looks like, it keeps it so much cleaner and fresher. Those folks who've got stomatitis from the denture wearing, just a little bit of gel. So to apply Perio gel, do I have a tube of gel here? I don't think I do. You take your gel, you take your tray, pretend this is gel. It just takes this long to put it in. If you've got a denture, you just do the same thing, put it on the bottom and put it in. But in general, the reason you want this particular tray is because it does such a good job of delivering medication deep. And it's not just Perio gel that you could deliver deep. There's a variety of different protocols. I'm happy to talk about it if anybody wants to, but that accidental discovery shows us that hydrogen peroxide is an excellent broad spectrum antimicrobial. And it's especially important because we are in the post-antibiotic age right now, right? So we are in an age when antibiotics do not routinely work for us for biofilm-based infections. So you guys, of the 5 of us here, I'm going to be 100% confident that all 5 of us know someone who's had a chronic sinus infection, a chronic bladder infection, or a chronic ear infection, and they've needed more than 1 round of antibiotics. Is that right? Yeah, those are all biofilm-based diseases. Periodontitis is a classic biofilm-based disease. There are a lot of reasons why biofilms can resist antibiotic therapy, and this is the stuff that Bill Costerton was excellent at explaining. I learned so much from him. They're all communicating, all being those cells, they're communicating. They create a thick, gooey matrix, which has a lot of protein in it, which is why hydrogen peroxide works well. It cuts through the matrix to get access to the cells, but antibiotics can't cut through that matrix. This is why when you use minocycline, you're going to place localized minocycline. You want to do it when it's being scaled or there's a maintenance appointment, because antibiotic placement right there without that isn't going to cut through the matrix very well. Once you remove it with your scaling or your laser procedure, the bacteria try to rebuild right away. A lot of them are dormant in a normal stasis situation, which may be diseased. A lot of the bacteria are dormant. Antibiotics don't work well against dormant bacteria. Once you remove the biofilm with the, let's say, scaling, then you're never going to get all the cells, but you would add some antibiotic there. That's a good time to do it because the cells are actively dividing suddenly, which is when the antibiotic is going to work, and the antibiotic can get access to it. That's the appropriate use. The benefit of Perioprotect is home use. So we always combine these things. Where was I starting with that question? I got distracted.
So
Sorry.
we like where you were going, and I think it definitely helped us along that journey. But one of the things, you need to be compliant with home care. You need to be compliant with using the trays. So how do you increase compliance, or how have you found with compliance with utilizing these this tool with patients and the offices that you've helped?
Right. This is so important because in order for it to work, it's home care, right? You got to use it. So the data does show that regular use. So we did a study. Originally, we told people you got to use it twice a day for the rest of your life. Well, that's a lot. There was a study that followed refractory patients who had all had surgery. And they used their trays. The pockets were surgically corrected. So that we didn't, but the periodontists were concerned about the bleeding and the chronic infection, even following the surgery. So they put the patients in trays. All of them started twice a day. Then half of them dropped down to 1 time a day. They had a 75% reduction in bleeding on probing for all of the pockets. And then for all the patients, all the pockets measured. And then they went out with that study for 5 years. And half the group stayed twice a day, half the group stayed once a day. And there was no difference between the two groups, statistically speaking. So we now say 1 time a day is enough for most people. So it's super easy. You just you stack your habits. Does anybody read Atomic Habits? Yeah, you stack your habits. You make small changes, and I see some questions coming in, so we will answer these. You make small changes, tie it to a shower, tie it to hair and makeup, tie it to walking your dog, tie it to watching TV at night, tie it to whatever you do. You only need 10 minutes. 15's best though, because you want all the oxygen benefits. And if you're walking your dog, I used to wear my trays when I had a dog, when I walked the dog twice a day. I would just put my trays in one of them in the morning. When I walk the dog, it's fine if it takes 20 minutes. It doesn't help you or hurt you. But essentially, patients have to make this own decision, right? They have to make it, and they can't make it if we don't tell them. So if you guys will indulge me, I'm gonna talk about our gum score for a moment because it is changing the game for a lot of people. See the screen here in just a moment, and I'll jump to the gum score. At Perioprotect, our goal is to prevent periodontal disease, gingivitis and periodontitis, or to address it, put it into remission, and prevent its reoccurrence. That's what we're about. It's also great for patients who are high caries risks. It's also great for patients who have halitosis from the disease, but essentially this is what we do. All that said, we have a remineralizing agent coming out in the fall, which I maybe we'll talk about again another time, but you can use the trays for remineralizing agents, whether it's a sodium fluoride, gel, or other hydroxyapatite products. We focus on bleeding as our primary indicator of who can benefit from Perioprotect because we know that those sites that have persistent bleeding, chronic bleeding and inflammation, are much more likely to have attachment loss. And this is a big, long study of 26 years. We also know that if you can stop the bleeding, it is a highly accurate predictor of no further periodontal damage. So what we want to do is stop the bleeding. And we created what we call a gum score. Gum score is just essentially your BOP number. How many points do you have that are bleeding? As a patient, you want the lowest score possible. So this information is patient facing, but let me just ask you all. I was in the doctor recently and I have high cholesterol. That was a surprise to me. The only reason I know it is because they took a blood test and said, yes, it's slightly elevated. We should do these things. So I only knew it because there was a score and because there was a range, right? How do you know if you have high blood pressure? How do you know if you have high blood sugar? You know, because there's a number and there's a range. How do patients know if they have healthy gums? They have no idea. And unless we tell them, and you can tell them that you have an infection and inflammation, but we have found in the last couple of years that we've been developing this and have really pushed it out as the way to start talking to patients in the last maybe 9 months. It really helps patients to have a number, to focus their attention, and frankly, your dental office's attention too, because there's so many things that go on in a dental office every day that it's easy to overlook gums that are just bleeding, right? It doesn't hurt. The infection seems routine. It's not normal, but it's common. It's not healthy, but it's common, right? So if you have a number, you know what's healthy and you know what you're aiming towards. So you want the lowest score possible. 0 would be ideal. We consider anything under 10 healthy. So here's how it works. And if anybody wants this, I'll put my email up at the end and I'll send you the conversation guide from Periprotect. But let's say, Kathleen, let's say I'm talking to you and you have 48 bleeding points in your mouth, which I know you don't, but let's say you do. I would say, I am concerned that you have a high gum score in our first step. That your gum score is 48. This means that there's 48 areas in your gums and in your gingival tissue that's bleeding and has infection. What do we want? The ideal score is 0. Anything under 10 would be considered healthy. So we want to work hard to get you from 48 to under 10. And third step, I know you're trying hard at home. The problem is your toothbrush, rinse, and floss just can't get deep enough to fight the infection because it's deeper in your gums. And that's why we prescribe Periprotect. It's a custom-made tray that it gently delivers the medication deep. It holds it there just 10 to 15 minutes so that it can be effective. Number 5, not only are you going to have healthier gums, but you're going to have whiter teeth and super fresh breath. That third step is really important because how many times do we make the patient feel like it's their fault because they're not brushing and flossing enough? And they're probably not. They're probably not flossing enough. They probably don't have great technique. They're probably not doing 2 minutes. I know I don't do 2 minutes every time I brush. So, but this is a fast way. I am concerned. The ideal score is, I know you're trying hard. This is why we prescribe Periprotect, and then the results. Some people are going to say yes. Some people are going to say, well, I need to think about it. And then this is like a no sales pressure, no pitch. You say, I get it. I understand that you want to consider it. And it's really important that you do consider this because it's not healthy. These are chronic infections in your gums. So what can you do differently now at home to try to improve your health? And we do leave it on them because we want them to make a decision, right? We want them to make a change. Otherwise, it's not going to change. And we have ridiculously high rates of disease. More than 50% of young people in North America, young being in their 30s, I've already have bone loss. By the time we're 65, 70% of us do. We need to make a change and we need to empower patients to do this. So what can you do differently now and wait for them to answer? They're probably going to tell you they're going to start flossing or that they're going to brush. Terrific. I'm going to document that and we'll score your gums again next time. And it's not going to change likely. But they have to go through this and they get to just determine it. The patient gets to decide what they choose. Then you might give them a brochure and you can say, let me know if you have any questions before your next appointment. We've been monitoring the health around your crowns and your implant. Healthy gums, we're going to help you keep those crowns and implants for a lot longer. You're just giving them factual information. Or if you know they have type 2 diabetes, for example, you would say, I understand. And I'm really glad you're going to consider treatment because it is important. This chronic infection is not healthy. What can you do differently now at home to try to improve your health? They say it, you document it, we'll score you next time. Take this information. Let me know if you have any questions before your next appointment. My main concern is that this chronic infection in your gums can make it harder for you to manage your blood sugar. And as a type 2 diabetic, it's super important for you to consider this. That's it.
These are really great slides, and I'm thinking, could you send me those last?
Yeah, I'm very
slides?
happy. Yeah, we have a conversation. I can do slides. Yeah.
Because I could share this in the follow-up in the after email, just like your communication.
Yes.
It's really good.
Okay, thank you. I will be really happy to do that. We have a conversation guide that's like front and back that's done for you. You can print out, it's really nice. And then we have flyers for patients. You can give them to help them understand what a gum score is, why you're scoring their gums, why it matters. And I think this systemic message is so important because from my point of view, when you practice hygiene, you are really treating chronic oral wounds. You are running a chronic oral wound care center out of your hygiene op. Whether it is gingivitis or periodontitis, if we leave these infections untreated, it makes it harder for type 2 diabetics to manage blood sugar. It can lead to inflammation in your arteries, they're saying now. So we're causal, we're at that level. Increasing risk for strokes and cardiovascular events. And this information is just so important for patients to understand. You don't have to tell them about the whole inflammatory cascade, but they need to know. And so the most important thing that you can do, and your work has profound implications for patients' health and wellness, which I'll talk about next, just because I'm passionate about it. When we treat patients who have periodontal disease, there are documented improvements in systemic health outcomes. They can't know about the treatment if they don't know they have the disease. The most important thing we can do is tell them. And sometimes I talk to hygienists and they are afraid that patients are going to reject them because nobody told them they had this before. But they need to know. They need to know because when you get treatment for these diseases, there's clear evidence for the effect of your periodontal therapy on patients' arterial blood pressure and stiffness. How many of your patients have high blood pressure? There's also evidence that periodontal therapy results in clinically meaningful and statistically significant reductions in hemoglobin A1C levels for patients with type 2 diabetes, that long-term measure of blood sugar. The drop in their blood sugar that they get with periodontal therapy is as significant as if you add a second medication to metformin. This matters. It's really important. It's so important for people to consider hygiene as almost like a primary care appointment.
Are there any contraindications or patients that wouldn't benefit? Like I completely agree. And I love that study that I often share in my lectures with regards to how hygiene, can help with all those things. But are there any particular patients where this is contraindicated for?
So it would only be the main contraindication with hydrogen peroxide now, because it would vary based on the drug you're going to deliver. That is cosmetic reasons. If you have anterior restorations, the natural teeth around, it'll take a while. It takes about a month to see the true whitening, just because it's such a low concentration of peroxide. But the natural teeth will lighten more than your restored sites will. So if you've got a veneer on 8 or 9, you want to make sure patients understand, because we have had some patients who they only opted for 1 tray, not 2. And I'll just tell you right now, they're going to come back quickly because they look weird. The whitening that you get is significant and you look strange. So it is because of that we say it's contraindicated for cosmetic reasons. Yeah.
And so if somebody has anterior bonding or anything else like that, making sure they're aware that if they use these long term, there may be a change, and then
That's
either
right.
you have to reuse it or using different potential that may offer an opportunity for the doctors to use a different material that, maybe is a bit more friendly with whitening alternatives.
Yeah.
Okay, great.
And if you're going to do a lot of work on someone, the question always is, new patients come in, they have caries and they have gum disease. Which do you do first? Right? This is a question. If they are anterior restorations, I would use unless it's, unless it's an advanced carious lesion, I would use Periprotect first, whiten your teeth as much as you're going to. Or let's say someone wants veneers. Great option. Get that tissue as healthy as possible so that you know exactly where your gingival margins are. And then you'll keep them there and keep them really healthy.
So how white can you get them?
You can get really white. In our controlled clinical trial, when we showed the data, and you can see that data if you go to perioprotect.com/research, data is right on that page. The only problem with the data is that we did not randomize patients for their tooth shades. We just, it was one of those things, you're doing a clinical trial. We're like, well, what else do we want to collect at the time? This is what the researchers asked me. They were at University Park Research Center in Fort Wayne, Indiana. They said, Tanya, we're collecting this other information. Is there anything else you want to look at? How about whitening? They suggested it. And so I said, okay. But because you're not randomized, you're not getting the true clinical trial effect. But you will see significantly. You want to see a couple photos of what we can do? It's pretty amazing. I go back to the screen. Let me find the right slide here. So before and after, here's a nice one. This is a patient who needed surgery and then did perioprotect. So you see pre-treatment at the top. The middle image is the surgical result, which is really nice. And then you see the bottom, that's 6 weeks of adding periotray therapy to it. There was also a prophy in there. But okay, so I always direct people to the gum tissue because look how much healthier the gum tissue is after you add perioprotect. But those teeth are gorgeous. We've had, you can see here, this is 18 months of perioprotect on a really advanced case. This is what the patient looked like pre-treatment, all the bone loss and deep pocketing. We got this patient to 0 bleeding points. You don't always get patient. I say we, the periodontist did. I had nothing to do with it. You don't always get people to 0, but we should get you to single digits if we can. This is an excellent, unfortunately, I don't have a pre-treatment because this patient was in trays for 10 years. He was one of those who had surgery and the pockets are surgically corrected, but there was still profuse bleeding. He's 68. Look at the stippling in that tissue. This is what I want when I'm 68. I want my tissue to be this healthy, but he loves his white teeth. We've even seen some whitening on patients who've had tetracycline stains, which I had heard about, but I hadn't seen before this case study came through. They did Invisalign first and then periprotect for a year. So around the 4-week mark, 3 to 4 weeks, you'll see significant whitening. It's a really pretty natural white. It doesn't look too outrageous, but there's also just no eating or drinking restrictions, which is helpful when you're talking to patients about this.
That's just amazing. Like
Yeah, people really, they want it for the whitening, but we want it to get them healthy, right?
It's all of it, just to even see the tissue, how much it's changed. It's awesome. So I know you recently launched like a patient resource center.
We did.
Can you just share a little bit about that with us?
I would be really happy to. So this patient resource center, I'm just going back to my slide deck here, has been something that we instituted very recently. It is a place where we at PeriProtect are directly interacting with patients, and our goal is to help them understand how to use their trays, to stay compliant with it, and to come back to you follow-up visits. It will also improve their success. So the Resource Center is just an online hub where they can get more information. We just unveiled this in February of this year, and by next year, it'll be much more robust. We're really focusing on gingivitis, the gum score, periodontitis. But in the next iteration of this, we'll have an entire educational track, patient educational track for patients with type 2 diabetes or cardiovascular disease, family histories of some of these other more common chronic inflammatory conditions so that they can understand why the health of their gums are so important. To get to this, you have this black case that you see here. It looks like a hockey puck here. This is our Perio tray case. And the code is right on there. Don't get too excited about the black case because it's going to be replaced by this beautiful white one here late summer, but it's still going to have the code on there. There's also a tip-in card that goes into some of the cases, and that takes your patient to the resource center, which is what you see here, the picture of the landing page. How it works in practice if you're delivering perio trays is you get the tray, you talk to your patient about their usage and the resource center. They scan the code. Your older patients might have to tell them, open your smartphone camera, scan it. Patient discovers it, and then they get 12 emails. They get several up front. The first one's like, congratulations on taking charge of your oral health with PeriProtect. This is what to expect at your delivery visit. The delivery video comes in another email. Before you get started, we have them take a really big, wide selfie so you can see as many teeth as possible. And we do it again a month later, getting them excited about their whiter teeth. Around the 3-month mark, the email that comes to them says, it's time for a checkup. Now, gingivitis, maybe not, but periodontitis, we want to make sure, ideally, you reappoint them before they leave the practice, but we want to make sure that they make that appointment also. And then when they come to you, when they come to you, when they register, we've gotten some really important information from this. They get the 12 emails if they opt in. They have to opt in for this. They also can give us some information about themselves. And we've had over 1,000 patients register. You don't have to get, these are not required demographic information. So like 9,060 people already have told us their age. It's a big range of people from 20 to over 70. Most of them are between 40 and 70, but you still have, more than 150 people who are under 40. So it's a good 15% there. The salary range, I think, is really indicative because often when I'm talking with dental teams, they're kind of squeamish about telling people how much to pay. And I know that, Beth, you were saying earlier that some insurance companies in Canada were covering some of the tray cost, which is great. We don't see much in the US for this. There's a couple plans, but it's not widely accepted for insurance. So people are paying out of pocket in a lot of ways. And a lot of normal people are saying yes to PerioProtect. And most of them have dental insurance. 15% over here don't, but most of them do have dental insurance. And the number one reason that they are getting perio therapy is because they know they have periodontitis. The second most common reason is because they're saying they have bleeding gums. And I think it's because of our gum score, the way we're presenting this. I'm concerned you have an infection, your gum score is 48. Ideally, it should be 0, but anything under 10 we'd consider healthy. That's where we want to get you, under 10. And having that goal is important because then they can pick it up at home with PeriProtect. Go ahead. I heard somebody intake.
Oh, yeah. No, I was just going to say, like, I love this because this is all about the after experience after the appointment and staying connected. And I'm always sharing on different ideas on how we can stay connected with our clients and our patients to really help educate them. So it's not just that time when you connect and say, oh, you're due for your next appointment. So you're educating along the way. Do you have anything to help? Like, I guess you said you had the brochures, but do you have anything to help educate to get the buy-in? Like,
We
do
do.
you have any emails or?
The video we shared with you, we have we have an entire YouTube channel, which you might find instructive. Most of them are shorter. We like to keep it under 2 minutes. There's a couple that are longer, but this one that I showed you earlier, that's 40 seconds. And we have chair side materials, some before and afters that we want to give people an idea of what they can expect. And then also those animated images so they can understand, look,
Nice.
we know you're trying, right?
That's
But there's
awesome. I love that.
brochures and demo models and posters and chairside guides. All of these things are available. In Canada, they're available from Curion. That's our distributor there. So you buy gel and you can buy all the materials here.
So as soon as you would sign up for it, then you would have access to all these things. And then you could even, I'm thinking like they could even snip capture, use it for social media, like do different things.
Yeah.
Yeah.
So, right. Once you become a PeriProtect provider, you get access, no charge, to our brand folder. In our brand folder, there are social media posts. I'll tell you, the one that gets the most attention on our social, like it gets 90% more attention than any others, is the social media campaign about gum disease and dementia. People are really worried about this. So there's systemic ones, there's whitening, there's fresh breath, there's a good value for you because trays should last years, right? If in maintenance or if you have gingivitis, they should last you a very long time.
I think even sometimes when we're showing the trays, they'll say, oh, I'm afraid my bruxers are going to chew through, but they're just wearing it for that 10 to 15 minutes of time. So
that's right.
It's nice and pliable. It's very comfortable, but it's, again, something that they're not wearing through the evening. So they're not going to be chewing through that.
That's
I'll
right.
put a link in the chat to some of the marketing material that you were talking about. There have been a few questions coming in. So let's see, where are we at? We have a couple more minutes. Could I just ask you a few of the ones that have come up? One of them is asking just about the impact on dry mouth. So could you speak to that part a little bit for us?
So the hydrogen peroxide, so for your patients who have dry mouth, and often their dentition is crumbling too, right? Because they don't have enough saliva to remineralize. This is the concern. The hydrogen peroxide will help manage the biofilm on your tooth surface as well as deep in the pockets, but we would recommend that you use the tray to apply remineralizing agents. So that could be a fluoride gel. There's a couple of other products that are out on the market that are super helpful for this. And I also, for patients with dry mouth, also there is a product from in the US. Is Perio Sciences available in Canada?
I think I've heard of that.
They have a gel that is the base of it. The actives are essential oils, help moisturize, and as long you have to watch sometimes for reactions against essential oils. But if your patient's not allergic to an essential oil, um, it can work very well also in the tray. Thank you, Lorraine. I appreciate. I see that they're not. So skip that. Yeah, the peroxide though does a great job of managing biofilm, getting the teeth clean, and then you would use a remineralizing agent. So, what kind of, Beth, do you guys have in your formulary anywhere a sodium fluoride or stannous fluoride gel?
We have, and I think we have one called Riemann that I noticed. I think it's just a different maybe distributor in the US,
Okay,
but Riemann is available. I think I
okay.
saw an image of ClinPro
ClinPro, yeah,
from
you
you
can
as
use
well.
ClinPro. That is, you can use paste in the gel, and I've done. I feel like I've used almost every product. Is MI paste available?
Yeah.
Yes.
Yeah, okay. So MI paste you could put in. The difference between the paste and the gel is just it's not an easy administration in the tray. So a gel is super easy with the paste. I don't know any good way except packing it in with my finger. That's the problem. And I can tell you that I've done this many, many times because I have a kid who has um he's he has fine motor coordination disorders and he had chronic acid reflux and his teeth were just so badly demineralized that we ended up I would never put children. I didn't answer this for you, Anna Louise. Second contraindication, children. Because their dentition changes so much, they're not ideal candidates for PeriProtect because they need trays more frequently. We did it for my son Adam, and he has been through several trays, but it worked really, really well to try to use this as a remineral. It's like the most precise fitting fluoride tray you've ever experienced.
Yeah.
Mhm. There's a lot of questions, kind of two big things. You've addressed it. You did address it, but maybe we can kind of come back to there's still that temptation to use or try to make the trays in office. So
Yeah.
maybe we can speak to that. And then the second question that we're getting a lot of is just around the oral ecosystem and just the impact that this has if there's studies looking at the specific pathogens it's targeting
Yeah,
and if
sure.
it's allowing. Those are the two main themes that are coming through today.
These are great. These are great questions. So repeat the first one because I got stuck on the biofilm and the bacterial one.
No problem. The first one is just about the tray. You did
Oh,
mention it,
making
but
them.
maybe just
Yeah. So the tray has a very specific design to it with the internal peripheral seal and the extension. And so it does get manufactured in a lab. So there are 3 labs within Canada we can direct you to. You could go to periprotect.com/Canada and you would find all kinds of information that is very helpful for you. So just perioprotect.com/Canada. For the research question, there are studies that have been published, and again, I would direct you to perioprotect.com/research, but let's talk about what works. So hydrogen peroxide is a broad spectrum antimicrobial agent. It works in 2 ways for our purposes as an antimicrobial agent by breaking down protein chains. So bacterial cell walls have a lot of protein. You cut through those protein linking chains, you cut a hole in the cell. Hydrogen peroxide is going to kill all kinds of bacteria, aerobic, facultative anaerobes, gram-negative obligate anaerobes, but it only kills the cells that it comes into direct contact with. So it never wipes them all out. That if you want to do that, start using a laser. And then they're going to repopulate no matter what. But the benefit of using this prescription home care is that the oxygen being released inside the sealed tray changes the environment. It's toxic to your gram-negative obligate anaerobes, and it is a healthy environment for healthy bacteria to repopulate. So what you see typically is healthy bacteria repopulating at the expense of the pathogens. And I don't want to take up too much more of your time, but if anybody wants to check in with me, I would be happy to go through any of these studies. It could be super helpful for you. I'm going to just put, if it's okay with you guys, I'm going to put my contact information up at the top.
I'll add it
Yes,
to
that
the
would
after
be.
email as well with a bunch of
Oh, okay,
links and
terrific.
stuff.
Okay, that's perfect.
Yeah.
That's
Yes.
great. They can
We're
just
gonna
reach
get
out.
to for sure. I think this is what happens with this. It's such an it always brings up so
Yeah.
many questions, which I actually love. So we're gonna respect everyone who's maybe joining us on their lunch break and wrap it up. But what we'll do is Kath will give them your contact information in the follow-up.
Great.
I will put it in the chat as well. If you have questions about what we were chatting about today and you want to directly interact with Tanya, we'll put Tanya's information in the chat. Curion is now the distributor in Canada for PeriProtect. So if I can be of any help, I'll put my contact information in there as well for you. So the two of us will be here. And then other than that, Kath, I will let you kind of wrap us up and let everybody get back to what they're doing.
Perfect. Well, that was awesome. Thank you so much, Tanya. I'm so excited. We're so thrilled to have you here on with us. I can just see the engagement here, and it was just such a fabulous show. So thank you so much. I'll just do a quick update for our members and for those who are new to RDHU. We're wrapping up our past academic year. We have a couple more weeks, and that'll be it for the summer, and then we're back in September. We will have our summer specials over the summer doing the Dental Hygiene Quarterly, purchase 3 years for a special price, and also the all access virtual pass. So that's the pass that we have a certain number that we sell that gives you access to the whole year, any of the courses that you want. And whether you can make it live or just get the recording, you can register for any course for one price. So that information will be coming out. For those of you who are new to RDHU, you will be put into our community. If you want to stay with us, it's fabulous. We'd love to have you. If you don't, you can always unsubscribe. But we just hit 20,006 this week. So we have 20,006 members. Yeah. So mostly Canadian, but some from around the world. So really thrilled to have everybody with us. We love and thank you. I saw some nice comments about how much you love RDHU and the courses and our show. So thank you so much. We appreciate you very, very much. Wishing you all a really great summer. For those of you, we have like 3 or 4 different events going on this weekend and next weekend. We have almost 100 people that will be here with us over the next couple of weekends. So really excited to see people in person. And then I'll be heading north for a little while and then back at it in September. Looking forward to a nice summer and wishing you all a fabulous summer and good health. And again, thank you so much, Tanya, for being with us. And yeah.
It was my pleasure. What a nice group. I really appreciate the opportunity.
Thank you so much. This was wonderful. Thank you for being here with us today.
Thank you.
Thanks, ladies.
Have a great
for
summer.
Being the best co-host with me.
Bye, everyone.
Bye.
Bye-bye.
Bye.
Safe travels, everybody.